Hello, I'm Dr. Matthew C. Wagner, Scientific Affairs Specialist with Sebia. Welcome to the Sebia USA Learning Series, where I'll be giving a quick insight on various topics. And today we'll kick it off with a video on the impact of diabetes. Diabetes is a chronic disease that affects millions of people in the U.S., over 32 million people, or more than 10% of the U.S. population, which includes both diagnosed and undiagnosed cases. In addition, an estimated 88 million adults have prediabetes, a condition in which blood sugar levels are higher than normal, but not high enough to be classified clinically as diabetes. Without intervention, many people with prediabetes will go on to develop type 2 diabetes. The prevalence of diabetes is increasing globally, and diabetes is now considered a major public health issue. There are several types of diabetes, including type 1, type 2, and gestational diabetes, with type 2 being the most common form, accounting for 90 to 95% of all cases. Risk factors for diabetes include family history, obesity, physical inactivity, unhealthy diet, and an older population. Certain racial and ethnic groups are also at a higher risk for diabetes. Diabetes can lead to a range of complications, including heart disease, stroke, kidney disease, nerve damage, and blindness. These complications can significantly impact a person's quality of life and may require ongoing medical care. Disease prevention and management are possible, yet can be challenging in some situations. Among these situations are a lack of access to care and resources, which are barriers for some populations, or even diabetic testing results that are challenging to interpret. We've just discussed the prevalence of diabetes and what could be contributing factors. But what's the impact? What does all this mean? Diabetes is a significant public health concern in the United States, and efforts to prevent and manage diabetes are critical to reducing its impact. Some of the key ways in which diabetes affects Americans are through the health costs that come with the disease, the disability and mortality caused by the disease, reduced quality of life, and extensive economic costs. Direct medical costs of diabetes were estimated at $237 billion in 2017, and an additional $90 billion in reduced productivity, totaling $327 billion of annual impact. These costs are likely underestimated. The economic cost of diabetes in the U.S. underscores the importance of effective prevention, diagnosis, and management to reduce the human and economic burden of the disease. The role of the laboratory in diabetes management is very significant. One way the laboratory is significant is through A1c testing. Hemoglobin A1c testing is used in diabetes screening, diagnosis, monitoring, treatment control, goal setting, and long-term risk assessment. This critical A1c value is generated in the laboratory, provided to clinicians, and used by patients to help manage their disease. It is critical that these results are accurate and received in a timely manner, since hemoglobin A1c is a crucial component of comprehensive diabetes care. The importance of delivering high-quality hemoglobin A1c results not only plays into diagnosis, but also into treatment decisions and overall patient care. When it comes to ensuring your lab is providing the best possible A1c results, there are other considerations or challenges aside from the quality of your result that may impact the methodology your laboratory chooses for A1c testing. These other challenges include workforce shortages. Many laboratories struggle to find and retain qualified personnel, particularly in certain specialty areas. This encourages the use of automation wherever possible. There is also an increased demand. As the population grows and ages, the demand for laboratory services, including hemoglobin A1c, continues to increase. This can lead to longer turnaround times for test results and backlogs of samples waiting to be processed. There are also, of course, cost pressures. Laboratories face increasing pressure to reduce costs and improve efficiency while maintaining quality. This can be particularly challenging for smaller laboratories with limited resources. Lastly, there are advances in technology. Rapid advancements in technology have led to an increased number of tests being offered by laboratories, but keeping up with the latest equipment and techniques can be costly and time-consuming. Despite your lab facing these challenges, there are A1C solutions that can help address these challenges and provide high-quality results. Let's learn a bit more about what some of the available methods are and which ones may be a good fit for your lab. One option I'd like to start by highlighting is capillary separation, or CE, a technology that offers high-quality clinical results, is easy to use, and can simplify operations in your laboratory by reducing hands-on time and making turnaround times more predictable. CE is a technology that meets expectations of your A1C testing volume when it comes to automation, while also exceeding market expectations by providing additional clinical information ignored by other methodologies. This information is essential in evaluating atypical patient cases. Let's look at those different methodologies now. Thanks to the establishment in the early 90s of the National Glycohemoglobin Standardization Program, also known as the NGSP, significant progress has been made in standardizing laboratory A1C testing. Today, the hemoglobin A1C test is widely used as a diagnostic and monitoring tool for diabetes, and standardization has helped to ensure consistent and reliable results. This has been an important step in improving the care of people with diabetes. This standardization means, in theory, regardless of the method the lab is using, a patient's A1C result will be the same no matter where their sample is sent. However, not all methods are created equal. This is demonstrated when the patient has interferences present, which may be common. These interferences include hemoglobin variants, such as hemoglobin S or sickle cell anemia, as well as hemoglobin C, E, and other less common variants. Despite standardization efforts, methods differ in their suitability for A1C testing in patients with these hemoglobin variants. To begin with, traditional immunoassay methods used antibodies to recognize a limited section of the A1C molecule to generate a % hemoglobin A1C result. Similarly, a newer method for measuring hemoglobin A1C is the enzymatic assays, which use enzymes that recognize and digest a targeted section of the hemoglobin A1C molecule. However, both of these methods are unable to differentiate between normal and most variant hemoglobins. As noted by the ADA, the presence of variant hemoglobins may lead to an altered relationship between A1C and the patient's glycemic state. The inability of these methods to detect the hemoglobin variants fails to provide additional information about the patient's clinical status, which may ultimately impact treatment. Another methodology with a similar limitation is boronate affinity chromatography. This is a technology that separates all glycated hemoglobin from non-glycated hemoglobin to derive its A1C value. Similar to immunoassay and enzymatic techniques, this technology is incapable of recognizing when a hemoglobin variant is present. In contrast, another method used for A1C testing is high-performance liquid chromatography, or HPLC. HPLC separates different types of hemoglobin based on their affinity for a packed column under different pH and ionic balances, allowing for the measurement of hemoglobin A1C as a percentage of total hemoglobin A. This leads to a patient result which displays the distribution of all hemoglobins in the patient's sample. This is an improvement in the case of hemoglobin variants, as many variants can be detected as separate and different from normal hemoglobins. Sebia's capillary electrophoresis, or CE, shares this advantage. CE is a method used to measure hemoglobin A1C, which separates hemoglobins based on their size and electric charge. It, like HPLC, also presents a pattern result showing all patient hemoglobins. However, Capillary electrophoresis provides this improved result with better resolution in a faster and more automated manner. The sophisticated software used with capillary electrophoresis technology enables clear, data-driven decision capabilities that may be ambiguous with the HPLC systems, which are only able to automatically flag major interferences. The confidence that CE provides assures labs they are generating the best possible results without sacrificing any conveniences of automation or throughput. Capillary electrophoresis, a newer method in A1c testing, provides not only superior clinical results, but it also offers lab solutions addressing today's challenges. Operationally, CE provides high throughput with over 60 results per hour on a single analyzer, which decreases turnaround times. It uses direct whole blood sample management, meaning no sample prep is needed and capped samples are loaded in racks directly onto the analyzer, streamlining the workflow and reducing hands-on time. Scalable platforms ensure a solution for every lab. From low-volume testing to high-volume labs, you can experience consistent, accurate results regardless of your lab's volume. In addition to the workflow benefits, CE offers high-resolution results, so you can have confidence that your results are accurate, precise, and free from interferences. All results can be auto-verified, or if your lab chooses, the results with hemoglobin variants can be held for additional commentary or review. This allows you to provide quality patient results with additional clinical information when it matters most, all while streamlining your operations. Sebia is the world leader in capillary separation technology and is proud to offer such a high quality and beneficial assay. Please contact us with additional questions and be sure to tune in to the next Sebia USA Learning Series.